Hello guys, this is Dr. T speaking. Welcome to today's episode. So guys, I'm a bit fluish, né? I don't know if I'm being honest if I say I've got flu guys, but I feel that a video is long overdue, so I'm gonna force myself to do this video and upload it. Please forgive me for my voice because of this flu. So what I want us to talk about is arterial blood gas. Arterial blood gas. You know, as a student doing fifth year, doing final year, as an intern, you are gonna be requested to do a lot of ABGs, arterial blood gas, especially in surgery, because if you often have critical patients in surgery, you are gonna do a lot of ABGs in neonates, in peds, ICU, and also in anesthesia, and also when you've got a patient in theater that changes condition. Sometimes even if the patient has not changed condition, but if the anesthetist want to check something, they can just ask you to run an ABG. So it's one of the things that will forever follow you. So yeah, so arterial blood gas, commonly known as an ABG. So basically it's a blood sample that you take, about 2 ml or a ml, and then you take it to the analyzer, and then the analyzer will analyze the blood for you and tell you what is happening in the blood. So the common things that the analyzer or the analyzing machine looks at on an arterial blood gas sample, it looks at pH, which is like acidity. It looks at the partial pressure of carbon dioxide. It looks at bicarbonate. It also looks at base excess. It also looks at obviously electrolytes like potassium, sodium, chloride, and also lactic acid. It also looks at HB and other types of HB. Some machines also do a met hemoglobin, a carboxyhemoglobin, and also an oxyhemoglobin. So these are the things that that machine looks at, and there are other things as well. There are other things like PF ratios, but the most common things are these ones. So let's just talk about the normal values. So the normal value for pH is 7.35 to 7.45. Normal values for partial pressure of CO2 is 35 to 45. Bicarbonate is 21 to 27. And especially this one, it ranges a lot from lab to lab. And then base excess range is -2 to +2. Yeah. So which patients should have their ABG done? All critical ill patients, they need to be done in ABG. All critically ill patients should be done in indications. All critical ill patients should be done in ABG. All meaning patients in ICU and those that are very sick with sepsis, chest trauma patients, especially a patient who's got a flail chest, or a patient who's got chest trauma, lung contusions. When you've got a flail chest, you've got a portion of the chest that is not really participating in gaseous exchange. So that area retains CO2, and then the patient ends up building up CO2. And also, because of the pain, sometimes when they inspire, there is pain, so they will end up hyperventilating. So major chest trauma patients should get, patients that have bled a lot should get an ABG as well. Patients that have bled a lot, like ectopic, things like that, step abdomens, things like that. Patients that have got a reduced level of consciousness. Another thing that this thing can also tell you is the blood glucose, amongst other things. So if you want to do a blood glucose but you don't have strips, you can quickly just do an ABG. But if you've done an ABG, you don't need to go and do a glucose. You can just check your glucose in the ABG. So basically, critical ill patients, whether they're in neonates, whether they're in internal medicine, whether they are in surgery, as long as they are critically ill, you want to see how their electrolytes are doing. You want to see how their acid-base status is, basically. So yeah. So now let's talk about so how does one approach this? So I don't know if you guys did realize that a normal pH is 7.35 to 7.45, and a normal partial pressure of CO2 is 35 to 45. So which means if you remember the 35 and the 45, it means you know the values of this and this, basically. Yeah, well, so how do you approach an ABG? When you've done an ABG, the first thing that you must look at, so this is an approach to interpretation. Or interpretation. So the first thing that you must look at the pH. Look at the pH. Don't worry about other things. Do it stepwise. Don't try to look at HB, look at blood glucose, look at that and that. Look at the pH. The pH is very, very important. The acidity of the blood is very, very important, and also the temperature is very, very important. Why is it very important to keep a pH between 7.35 to 7.45, and also why is it important to keep a temperature that is the highest temperature that a person should be allowed to have is like 37.5, 37.6. The minute you get to 37.89 and to 38, then that's a very high temperature. And also the reason why you shouldn't have hypothermia, this is one of the reasons. pH balance should be within the normal ranges. Temperature should also be within the normal ranges. The reason is this: in our bodies we have got a lot of chemical reactions that sustain life. Chemical reactions that sustain life, and these chemical reactions, they happen. There's like billions of chemical reactions that are happening in our body just to keep us alive, just to sustain our lives, our biological lives. So these chemical reactions, they are catalyzed by enzymes. And as we know that majority of enzymes, are proteins. Majority of them, they are proteins. And remember, some hormones are also proteins. So what I want you to remember here is proteins. And we know that proteins are very sensitive to high temperatures and low temperatures. They're very sensitive to changes in pH, like extreme changes in pH, such that they denature. Proteins denature, which means to denature is to lose. They lose their structure. And once they lose their structure, they can't function. And if you have got proteins that have denatured, and these are the very same proteins that are meant to sustain life, patients will die. That patient will die. Because they are chemical reactions that are so important that everything must always run smooth. Remember, enzymes, they catalyze reactions, but they don't initiate reactions. They don't get consumed in reactions. They catalyze, so they just speed up the rate at which reactions are happening. There are reactions in the body that are so important to sustain life, but without the intervention of a catalyst, they would take minutes to happen. They would take hours to happen, some of them. They would take days, some of them, to happen. And by that time, the patient would have died. So enzymes are there to catalyze, to make them to happen in milliseconds. So that's why they are very important. So if you have high temperatures or low temperatures or extreme changes in your pH, you will denature the proteins. And once you denature the proteins, you denature the enzymes, because many enzymes are proteins. And also, like we said, many hormones are also proteins. So remember, many of our glands, they communicate via hormones. So it means now if those hormones are denatured because they are proteins, then there won't be communication between the organs. So it's just disaster. So that's why people who have got high pH or very low pH, they just lose consciousness, they become lethargic, they become this and that and that and that, and then they eventually die. That's one of the reasons. So that's why it's very important. I want to stress this because it's very important. So they denature, they lose their shape, and then they can't function. So which means now those reactions that are important to carry life, to sustain life, they won't happen. And the patient is gonna get, is gonna demise. So that's why it's very important. So now, so when you get an ABG strip, first look at the pH and decide if your pH is acidic or if your pH is alkaline. Decide. And you're gonna decide, you're gonna look at the number, the pH value for the patient will show then. So which means now you're gonna have a pH value here that is more than 3,45 and a pH here of less than 7,35. So you look at that and then decide, okay, I have a strip of an ABG of my patient and I can see that my pH is less than 7.35. So now I say, okay, because of that, I've got acidity. My patient has got some kind of acidosis. So now I want to decide, what kind of acidosis does my patient have? So the next thing that you look at is your partial pressure of CO2. You need to look at the partial pressure of CO2 and see, does it agree with acidosis or does it not agree with acidosis? Remember, the partial pressure of CO2 can either agree with the acidosis or it can disagree with the acidosis, right? The only thing that controls the partial pressure, the levels, is the lungs. There's nothing else, is the lungs. So if I've got acidity and my partial pressure of oxygen does agree that the acidity is from CO2, then that's a respiratory. But if I've got acidity, but the partial pressure of my CO2 does not agree with acidity, it means that that acidity is not respiratory. It must be metabolic. I want to repeat this again. I'm saying, if you look at your pH and then you see that my pH is acidic, you say, okay, acidic. Now, let us see, is this pH acidic because of a CO2 problem, or is it acidic because of a metabolic problem? So you look at it and say, okay, acidity, but partial pressure, what is the partial pressure doing? The partial pressure of CO2, does it agree with acidity or does it not agree? If you've got acidity and your partial pressure of CO2 agrees with acidity, then that acidity is respiratory. But if you've got acidity according to your pH, but your partial pressure of CO2 does not agree with acidity, then it means that acidity is not respiratory, but it's metabolic. It's metabolic. So you look at your partial pressure. Let's say now my partial pressure here is less than 35 and this side is more than 45. A partial pressure that is more than 45 means that it's high. My partial pressure is high, which means that my body is retaining a lot of CO2 than it's supposed to be retaining. So I'm trapping a lot of CO2 in my lungs and in my body that I'm supposed to be doing. And we know that a buildup of CO2 in the body causes acidosis. So which means, because my partial pressure of CO2 does agree with acidosis and I also have acidosis here, then it means this patient has got respiratory acidosis. Let me show you something. Why am I saying a lot of CO2 causes acidosis? This is the reason. When you've got water that combines with CO2, you get carbonic acid. And then obviously it's going to break down again. But you get carbonic acid. So we know that if you've got two reactants and you increase one of them, you are pushing your reaction to this direction. So which means that if you've got these two and then you increase CO2 as you are retaining CO2 in the body, you are pushing that reaction to that direction. So because you've got a CO2 built up, a lot of CO2 combines with water and cause results in carbonic acid. So that's what you get. You get a lot of acid. Obviously, it's going to break down again into H plus and later on other products. But this is the most important that I want you to remember. So you've got acidity now. So we said that we got a strip and we saw that we've got acidity. Now we say, okay, we know that we've got acidosis, but where is the acidosis coming from? Is it respiratory or is it metabolic? So to decide that, we look at the partial pressure of CO2, and then we look at this guy. We say, okay, the partial pressure of CO2 is high, and we have acidosis. So this partial pressure that is high agrees with acidosis. Sorry. So our patient does have a respiratory acidosis. We say it's a respiratory acidosis because for you to have a buildup of CO2, it's a respiratory problem. Let's look at this side, the contrary. So we say here we've got acidosis, and then we look at our partial pressure. But our partial pressure, instead of it being high to show acidosis, it's low now. So our partial pressure is low. So which means we know that once you've got a decreased partial pressure of CO2, that is less than partial pressure that is less than 35, then that's not acidosis. This should give you alkalosis instead. But our pH is not alkalotic, it's acidotic. So which means this acidosis is not caused by a decreased CO2 because it's acidosis. And we know that a decreased CO2 gives us alkalosis. So it means this acidosis that we have is metabolic. So it's metabolic acidosis. So I want to make these videos short. So I'm going to pause this one and we're going to continue on part 2. Thank you.